Good morning. Today we're going to discuss smoking and the deleterious effect that smoking can do. First of all, I'm going to scare you and say smoking and death. Cigarette smoking is a leading cause of preventable death in the United States. More than 480,000 deaths each year in the United States, and this is nearly 1 in 5 deaths because of smoking. Smoking causes more death each year than the following causes combined: HIV, illegal drug, alcohol, motor vehicle accidents, firearm-related accident. More than 10 times as many as U.S. citizens have died prematurely from cigarette smoking than have died in all war fought by the United States. Smoking caused 90%, 9 out of 10, of lung cancer death. More women die from lung cancer each year than from breast cancer. Smoking causes 88 out of 10 of all deaths from chronic obstructive airway disease. Cigarette smoking increases the death from all causes in men and women. The risk of dying from cigarette smoking has increased over the last 50 years in the U.S. Smoking and increased health risk. Smokers are more likely than non-smokers to develop heart disease, stroke, lung cancer. Estimates show smoking increases the risk for coronary disease by 2 to 4 times, for a stroke 2 to 4 times, men developing lung cancer by 25 times, women developing lung cancer by 25.7 times. Smoking causes diminished overall health, increased absenteeism from work, increased health care utilization and cost. Effect on cardiovascular disease. Smokers at greater risk for disease that affect the heart and blood vessels. It causes stroke, coronary artery disease, which are among the leading causes of death in the United States, even though people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thicken and grow narrower. This makes your heart beat faster and your blood pressure goes up. Clots also can form. Stroke occurs when a clot blocks the blood flow of a part of your heart or brain. The blood vessel in and around your brain bursts. Blockage caused by smoking can also reduce the blood flow to the legs and the skin. Smoking can affect on respiratory disease. It is damaging to the airway and small air sac alveoli in your lung. And lung diseases that are caused by smoking, COPD, which results in emphysema and chronic bronchitis. It causes lung cancer, it causes asthma. Tobacco smoke can trigger an attack and make an attack even worse. Smokers are 12 to 13 times more likely to die from COPD. Smoking and general cancer. Smoking and cancer can cause almost cancer anywhere in the body: in the bladder, blood, cervix, colon and rectum, esophagus, ureter, kidney, larynx, liver, oropharynx, include parts of the throat, tongue, soft palate and tonsils, pancreas, stomach, trachea, bronchus and lung. Smoking and other risk factor. It harms every organ in the body and affects the person's overall health. It can make it harder for a woman to get pregnant, and it can affect her baby's health before birth and after birth. Smoking for women increases the risk of preterm labor, stillbirth, meaning death before birth, low birth weight. It's one of the main causes for intrauterine growth retardation, and sudden death syndrome, which is what's called SIDS or crib death, ectopic pregnancy, orofacial cleft in infant. Smoking can also affect men's sperm and reduce fertility. increases the risk of birth defect and miscarriage. Smoking can affect bone health. Women past the childbearing age who smoke have a weaker bone than those who never smoked. They are at greater risk of a broken bone. Smoking affects health of your teeth, gums, and can cause tooth loss. Smoking can increase the risk of cataract, clouding of the eye lens that makes it harder to see. It can also cause age-related macular degeneration, and that is a small spot near the center of the retina, the part of the eye needed for central vision. Smoking causes type 2 diabetes mellitus and can make it harder to control. The risk of developing diabetes is 30 to 40% higher for a active smoker than non-smoker. Smoking also causes adverse general effect on the body, including inflammation, decreased immune function, and it causes rheumatoid arthritis. The ideal thing is to quit smoking. The reason to use, there are 3 reasons to use medicines when you want to quit. There are 7 U.S. Food and Drug Administration approved medicine for adults to use when planning to quit smoking. In 5 of these medications, nicotine is the active ingredient. Nicotine is the main addictive drug in tobacco that makes quitting so hard. The medicines with nicotine are called nicotine replacement therapy. It comes in all sorts of forms, in form of patches, gums, nicotine lozenges, nasal spray, and inhaler. 2-pill medicine, varenicline and bupropion, do not contain nicotine and help people to stop smoking in other ways. For example, varenicline attaches to some part of the brain as nicotine, reduces the urge to smoke. It also makes cigarette smoking less pleasurable by blocking some of the nicotine receptor. All these medicines can help with smoking in 3 ways. First of all, they can take for them to work long time, about 6 to 12 weeks or longer, depending on the medicine. The nicotine replacement therapy use enough to relieve your withdrawal symptoms and craving. That means you might need to use 2 instead of 1 at the same time. Follow the instruction on how to use them correctly. Get some coaching on tips and tools to quit smoking successfully. Quit smoking medicine are not magic bullets that guarantee that you will quit. The good news is that a lot of tips that can make quitting easier. Free coaching is also available, including quit line such as 1-800-QUIT-NOW. Your doctor or other health care provider can provide support and ideas to help to quit. They can also choose a medicine that will help you. How to quit? You can quit smoking, and this is how. This is the most important step that you can take to improve your health. And this is true no matter how old or young you are and no matter how long you've smoked. Many people who smoke, of course, are addicted to nicotine. And this can make it harder to quit smoking. The good news, there are proven treatment, medication, counseling, and these 2 of them can help quitting. The medication, we spoke about them, and counseling either as an individual or in a group. There are many lines to help you quit smoking. There's a free confidential coaching through telephone quit line 1-800-QUIT-NOW, uses of free online resources like cdc.gov.quit and smokefree.gov. Sign up for free texting like smoke-free text. To be honest, at the end of this presentation, there is nothing that can make you quit forever unless you decide to do so. And I'm not going to discourage you by providing numbers and percentage of people who were not willing to quit seriously and they relapsed. It's very important that you decide to quit and use all the means available to quit smoking for all the reasons that we've discussed. Have a great day.